What a start.
I know, right? Our music is so catchy. How are you, baby?
I'm very well, thanks.
Happy. What's today? Saturday, everybody.
Just happy to be happy.
Exactly. Um, I can't keep track what's the episode now, but I think it's episode 10, if I'm not
Really?
mistaken. But I'm gonna look it up because remember we had a hard time discussing about the episode, and we're having a hard time putting a thumbnail.
We've lost
Or-
track, guys.
But yeah, welcome back, guys. I'm Sheila,
And I'm Ruel.
and welcome to
The
CommoNurse
CommoNurse Podcast.
Podcast. Yes, let's
All
do
right.
it
What are we going to talk about tonight?
tonight. Ooh, something that I find interesting. I hope you would find interesting as well. So we're gonna go back to a little topic of ours that we
Nursing.
call nursing. Yeah. Not really a little topic, but something that we are very much familiar with, isn't it? So tonight
Well,
we
it's
are
our livelihood.
exactly. Tonight we're gonna talk about the pet peeves that we have
At the workplace?
At the workplace, exactly. So I'm
Ah,
gonna explain to our listeners that, according to Google, pet peeves is something that a person does or someone does to annoy you.
Good to know.
Yeah, what are the things that you find annoying in the workplace? I think you should start this one, babe.
Ooh. Like, I'm not going to cite a specific
Yeah.
action or incident because I think that's going to give it away as to who it is. But I actually hate the type of staff that pretends that they know everything.
Mm-hmm.
Like, I don't get it. Like, it wouldn't make you a less of
Sino
a
to?
person. No, it
Joke
wouldn't
lang,
make you a less of a person to admit that you don't know how to do it, especially if you're new,
Exactly.
right? Because
Yeah.
we know that you are new.
Mm-hmm.
We don't expect you to know everything, so just ask.
Yeah. I don't know. I feel like it's maybe they're a bit proud or maybe they're prideful to
Well,
ask.
could be,
Yeah, because sometimes
but don't you think that's dangerous though?
it is. For me, it is. I'm with you on that because, like, seriously, for example, like, you thought, like, even just a simple cannulation. I'm not saying it's simple. It's still like you're handling, you're putting in an invasive object,
yeah.
instrument to a patient, and you're introducing infection, and also you're collecting blood samples. That's basically like, you have to know what to do. But yeah, if you're trying to let me know that you know what you're doing and you've been doing this a long time, but then you've been poking this patient for like what?
The last 15 minutes or so.
Yes, and also like, that they're actually bruising and you've poked them like say 5 times and more. Like,
Ouch.
yeah, that's not right.
That's a no-go.
I mean, you have to set your boundaries within yourself. You
Yeah.
have to have that confidence and you have to have that awareness of when to stop,
Yeah,
isn't it?
look, I think I previously mentioned in our past episodes, like I have a certain tolerance to bullshit.
Yeah.
But this thing is just I don't know. Sometimes, well, it hasn't happened yet, but sometimes I'm nearing my, I don't know.
Your
What's the proper term?
patience meter, is that right?
Yeah. Like
Yeah.
I'm about to blow off. Like I'm about to tell you off that
You don't want to see him
Yeah.
angry, guys.
help me here. It's like help me help you. I was like, cause if they're new, like I'm actually really patient in teaching them how to do it properly.
Yep.
Like, cause I hate putting them on the line, like, cause it's unfair for them. Like,
Exactly.
just to throw them on the line of fire and then knowing that you didn't teach them well.
Yeah, and
So I hate that because I think it happened to me when I first started. Because people had a lot of expectation. Well, I wasn't shy to admit that I don't know all this stuff.
yep,
I'm always gonna ask you a question,
exactly.
and if you're not willing to help me, that's fine. I'll ask someone else. But yeah,
And also, if you think about it, babe, it is a reflection of you, isn't it? Like, it's a reflection of how you are as a mentor, as a say like a senior staff because it's
Mm.
still within our scope, guys. Just to let you know, to all the nurses out there, wherever you are in the world, it's still within our scope to actually teach the
Mm.
next generation of nurses. How can we know if they're going to be great nurses if we don't teach them the right
Yeah.
things? And
It's just sad though, because you'll hear reports from other staff members like, "Oh, I'm pretty sure you taught this guy before,
mm-hmm,
and then how come he still doesn't know up to now like how to do things?" Like when we ask him, so
mm,
this like a staff member of ours would just cite an example,
yep,
saying, "Oh, I was working with this guy yesterday, and I'm pretty sure he's done that like for a while now. Like he's been doing that shift for the last 5 6 days. How come he still doesn't know how to do things?" Like he'll say that he knows how to do it,
but he doesn't do
but
it,
he doesn't do it.
or he doesn't really know how to
Yeah,
do it.
well, yeah. Anyway.
It's either or. Um, I guess you know what, like in a way, it will make you feel guilty, isn't it?
Mm.
Like, did I really teach that person properly, or
Like at the back of your mind, you're trying to think, is he really here to learn, or is he here for, I don't
for
know,
anything else?
for whatever reason?
Yeah, true. And I guess you know what, you can only be again. You're probably, I don't know if patience meter is a term for it. Like I feel like sometimes kung sa Tagalog may hangganan tayo. We have that
Limitation.
limitations as well on when to actually stop. Like
Mm.
instead of us like probably tell something off or tell a person off or probably say something that would really hurt them, we'd rather stop.
Mm.
We'd rather say, okay, I'm gonna move away now because you're not really learning from
Yep.
me. You don't want to learn from me.
Yep.
Okay? So it's not because of you. It's actually that person's action that will make them do that, isn't it?
Mm.
Like,
Very true.
yeah, so you just have to know when to stop.
But whenever I work with him though, like I will always try to give him the autonomy
Yeah.
to initiate doing things.
Yep.
Just like I'll just observe him, make sure he's doing things correctly, and
Mm-hmm.
sometimes I'll just be left dumbfounded by the fact that, oh,
He still hasn't do it.
yeah.
Oh well, I guess like it's
Which as a senior staff member, like it
it.
puts you in a position like, have you done the right, like did you actually do your best to teach this new
Mm-hmm.
staff member the right thing to
Yep.
do, or you just,
And it gets you frustrated, isn't it? Like
yeah.
it's just sad that you tried your best.
Mm.
I think like every one of us tried our best to actually be patient, like in a kind manner to actually teach someone because you don't want to imply that they don't know shit, but they actually don't know shit. Um, but then
Like especially
again,
you, like because I'm pretty sure you can't hide in
I
your face
know
like the
one
way you're
thing
feeling.
exactly.
Like you're very poor in doing that, to be honest.
One thing about me, guys, that you should know about is that I don't have a poker face. What you see is what you get. So again, no tolerance to bullshit, and also like if you see that I'm angry, you would definitely see it in my eyes.
Yeah.
If you see that I'm happy, I'm definitely have a smiley eyes.
Mm.
My eyes never lies. That's to put it.
Like compared to me though, I would still smile at you and then like
Yeah,
make
yeah.
something fun out of it, like regardless how bad the situation is.
Yeah, but I guess like it just also makes me authentically me, isn't it?
Yeah,
Like
yeah.
I,
You can call it whatever you want.
yeah. Well, I'm not sugarcoating anything.
Mm.
Like you want to get to know me. This is it. There you
You have to
go.
balance it out though, because the
I
era that we're
do.
in at the moment,
Yeah,
it's like the PC era. So
yeah. I
you also have
understand.
to.
I look. I try my best, but then again, that's what I'm saying. Like if I know that I can't really like handle how you
Mm.
do things as well, I'd rather walk away
Hang
and
on, can you
then
quickly show the camera how your face looks like? Oh, hang on. Again.
what? Yeah. Oh well. It's hard to mask this thing because I already have a mask, and I'm hoping it's doing its job, but
Mm.
it's like no, my eyes says it all. So anyway,
Like, hang on. Let's discuss that even further.
yeah.
Like, were you ever put in a position where you were asked if you know how to do things, and you said you know how to do it, even though you don't know how to do it?
I guess sometimes, like, say for example, I don't have the confidence, but
Mm.
I think I know what I'm
Mm.
doing. So
Like yeah, yeah. Like you can admit that.
yep. And I haven't done it a lot. So
Mm.
that's when I'm like, I really like say, um, I know how to do it, but I might need someone to supervise me
Yeah.
for now.
There you go. Mm.
Okay. That's the right way to put it, to put things, because in a way you're admitting that, hey, I'm still practicing. I'm new
Mm.
at this. Maybe you can show me. And that probably that kind person would show you properly,
Mm.
isn't it?
Yeah.
And then once they've shown you how to do things, the next time you do it, you're confident enough.
Mm.
I would like to set an example. I guess catheterizing male patients, it's difficult. And this is like to nurses, nurses that are listeners to this podcast. Correct me if I'm wrong, but like male catheterization, I find it very challenging.
Really.
It's, well, I guess it's especially if they have like underlying
Mm. Oh
circumstance
yeah.
like
Sure.
BPH or something, like they have current stent that's been happening. I don't wanna
But wouldn't
risk it.
always there be like a problem whenever you decide to catheterize someone?
Well, there is like the risk of infection is very high, but I guess as long as you know what you're doing and you know how to do a proper like sterile technique,
Mm.
I guess you'll be all right. And you know that the advantages outweighs the risk.
Mm.
So if it's really clinically important or needed by the patient, then I wouldn't mind doing it. But I've done it a lot of times. But the first time I've done it, I was like, Lord, please. I was praying so hard. I was like, Lord, please just let this be a smooth one. Let this be like a good one, a good practice for me, so I
Mm.
can actually gain my confidence in catheterizing patients. But normally, I would ask if they're like they have underlying clinical conditions that would actually like hinder me to
Mm.
catheterize them, because like one example is like a recent patient of mine. He just had a stent put in, and he was told to have a catheter. I was told by the doctor that the, they want a catheter to be put in for him, and I'm like, I'm not comfortable. I told her that I'm not comfortable catheterizing him because he just had a surgery.
Mm.
So I'd rather have you, because because they're like specialists. They
Mm.
specialize in neurology. So technically they know more than the anatomy more than I do. I've seen a lot of, let's call it, penises that been traumatized because of what? Because of like we've been trying so hard to pop in a catheter, and like we're just injuring the body part. It's
Mm.
just sad. So I don't want to do that.
Okay.
Okay. Any like, do you have any example for yourself as well? Like, do you have like an experience that you were asked, like, hey, do you know how to do this, but then you don't know how to do a thing?
When I started,
Mm-hmm.
there was a lot of situations where they asked me if I know how to do it, if I'm confident.
What
That
is this?
I'm just trying to remember. Uh, what was it?
All right, guys.
I'm
Kakakain
having
lang
a
namin.
I'm having a brain fart at the moment.
Kakakain
Like
lang
I can't
namin.
cite a specific
Sir Busog.
example, but yeah, like because I'm always the type of person that would admit to you that I would need help if
Yeah. Yeah.
I genuinely need help.
Yeah, well, I guess the takeaway of this first pet peeve that you
Mm.
have is that, like, there's nothing wrong, like, just ask.
Oh, now I remember when I just first started. Like we were put in an emergency situation, and I was the one who was pushing the emergency trolley,
Mm-hmm.
and there was these two senior staff members that I was going with,
Mm-hmm.
and they asked me to grab something from the trolley, and I was
Yep.
like, "It's my first day at work." I was like, I wouldn't have a clue where to get that.
Mm-hmm. So,
So there you go. And
yeah.
then she asked me, "Oh, what do you know? What can you do then?" So I was like, "I'll scribe for you." So I started scribing.
Yeah, okay.
It's like, cause I wouldn't have a clue what's inside the trolley.
Exactly.
Like I haven't even had my orientation yet.
Yeah, and you need more training, isn't it?
Mm.
So, I guess like you it's good on you
Mm.
for acknowledging that, firstly. Secondly, good on you for at least trying.
Yeah, yeah, yeah,
Because
like
you actually, it's not that you put it into action. You're
mm,
actually scribing, which is also same as important as
mm.
anything else. Others like action. I do love them, but sometimes documentation also is one important thing, because
Well,
if
it's
in
yeah, it's a big thing because
yeah,
you're the one. Since you're scribing, you're the one who's gonna hand it over to
the next,
the ambulance people if they'll come and pick up the
yeah,
client. I think
exactly,
which they did at that time.
yeah,
I can't. That was 5 years ago.
yeah. But then again, yeah, good on you, because
Mm.
it's like at least you've done something. You
Yeah.
didn't just sit around like, okay, I don't want to do things because I haven't done this before, isn't it? So it's quite, yeah. But
All right.
again,
Moving along from my example, what's
hmm
yours?
well,
Was that part of yours as well?
which one?
My example.
Oh, well, I think we agreed to
Yeah, yeah, yeah.
agree on all this. But my pet
Because we've never
peeve,
discussed any of this before we
no,
started
we
recording.
haven't. No, we haven't. Usually we don't because it's gonna mess up the whole podcast, guys. So, my first pet peeve is that the lack of initiative. I think it's just another category from where you're at. Not only like you act like you know everything, but you lack the initiative to actually
Make yourself useful.
make yourself useful. Yeah,
Well,
it
sometimes
does.
I'm guilty of this nowadays, though. It's like can't be bothered.
Yeah,
You
yeah,
do whatever you
you're
want.
too lazy to actually do things. But well, going back, I think it's just like common for me. It's basic, like basic, but basic yun na siya. For example, like just
Mm.
restocking things that, like, we have. It's not an emergency trolley, but it's our like cannulation trolley, like everything trolley in there. So just stock it up, because
Mm.
if you're free, the next people that would go on shift would appreciate that their trolley is stacked up and they
Yeah.
don't find things like, oh, I'm missing a bung, and then I'm about to cannulate a cat 2 patient because, like, no, I have to run, I have to pick up some things because
Mm.
our trolley is empty. Like that, those are for me like basic. Okay, I would understand if this shift is so busy and like it's crazy busy
Mm.
that you can't really do anything. But if you get a chance, like, why not just grab a thing or two? I would appreciate
Yeah.
that, right?
Like I have something relatable to that though, because
Mm-hmm.
um we recently had an influx of new staff members.
Yep.
But they've been in the profession for a while now.
Mm-hmm.
So they're experienced.
And you, sorry, also to add into that, you would expect them to know more, isn't it? Like,
Yeah.
because they're
Look, since
not
you
really
spoke about
expect, but
the trolleys,
yeah.
so and I've also mentioned the emergency trolley of ours
Mm-hmm.
just before this. So as a new staff member, you kind of expect them to actually be the one to initiate and check the emergency trolley,
Mm-hmm.
because as a senior staff member, regardless of how the trolley would be like prepared, already know what's inside of it.
Yep.
You know where to grab what. You know what instruments are in there.
Yep.
So like one time there was this new staff member asked to check the emergency trolley.
Mm-hmm.
They said they won't do it because they're new. It's like that's the reason why they asked you to do it, to get for you to
Exactly.
familiarize what's inside.
Yep.
Because if you're asking me to do it, like yeah, I'm gonna do it,
Mm-hmm.
but like it's gonna be more beneficial
For you.
for you in case
Yep.
a situation comes that you're gonna need to open the trolley and you'll be asked to grab stuff from inside.
Exactly right.
Mm.
And I find it like you just don't say for me, okay, this is like personal. I don't just easily say no. I would
Mm.
say, okay, I will try, but if I need anything, can I ask you
Yeah, yeah.
something?
It's like
Right?
rather
Like
rather than turning it down, you can say, "Oh, can we check it together?"
exactly.
Yeah.
Like the initiative into it. Like
Mm.
you just don't dismiss the fact that you've been allocated a task
Mm.
because hey, I'm new. Regardless if I'm new, we all started from where you're
Yeah,
at.
exactly.
Right? And it's, again, you mentioned it's another like learning opportunity for
Mm.
that person to actually get to know the trolley.
Yeah.
Yeah, and it's like in case of emergency, we can expect you to step up,
Mm.
to actually give us the medication that we needed or anything in that trolley that we need in times of emergency.
Yeah.
Like those kind of things. It's just
Like,
like,
as when the time comes, I don't want you to tell me like what happened to me when I just started. It's like,
mm-hmm,
I don't know what's inside here. It's like,
yeah,
shut the f up. You've been here for 6 months. Don't tell me you don't know what's inside of it.
exactly.
Because we're meant
Were
to
you
check.
there 6 months already when you
No, no,
said no?
no, I'm just citing an example.
Okay.
Yeah.
Okay. I was like, what? Really?
Like, come 6 months time,
Mm-hmm.
and then we're responding to a code, and
Yep.
it's you and me, and I ask you to grab what stuff from inside,
Mm-hmm.
and you tell me you don't know where to find it. Like, that's gonna be on you.
Yeah, it is gonna be on that person. And also, like, I just want to add to the experience that, like, we get a lot of new rotation of doctors that's coming in. So they do like a 3 monthly
Mm.
rotation in ED. So sometimes they get rotated to a different areas, like, uh while, after they finish their cycle in ED. So new doctors come in, and then sometimes, of course, you see that they're lost. Like, you see that, like, oh, sister, can you please tell me where this is and this and that? Like, I don't even know where it's put, but I try my best to actually bring the doctor to the storeroom. We'll find it together.
Mm.
And then once we find it together, it's also a learning thing for me and also a learning thing for the doctor.
Mm.
Like, the doctor won't even have to ask another nurse next time because they already know. Does that make
Exactly.
sense? So
Yeah, yeah.
it's like hitting two birds in one stone, isn't it? Like,
Yeah.
it's just those simple things. I just don't understand sometimes, like,
Mm.
why is it like initiative doesn't really exist anymore, right? Like, I don't know if it's just purely
Listen,
laziness.
I was gonna say.
Yeah, or it's just
I
like
was trying to find a
you
more
just don't.
politically correct description
But
towards
there's
it.
no other description for it.
Really? Okay.
I feel like it's just, is it like pure
Look,
laziness?
sometimes, like, I'm guilty. Sometimes I would be lazy at work too. I just don't feel like doing anything.
But
But yeah.
yeah, we have our days. Look, let's not be like hypocrites here. We're good ones when we work. Sometimes we have like not really good days. We have like lazy days,
Like, for example,
which
today, I was paid like a full overtime shift without doing anything.
don't tell him that. But anyway, it's just that, it's really like a factor that we should really keep in our hearts, because sometimes, like, it's also being lazy, and also you just don't effing care.
Mm.
You just don't care. Like, for the next staff, for the next patient that comes in, like, you just don't care. That's it. All right.
Have you ever been on that stage though?
That, like,
Like, no,
I'm
no, no,
lazy.
like, you don't care.
No, because basically what I end up doing, like, that's why I'm super tired, because I just can't not care.
Yeah, knowing you, yeah, I can see that happening.
Exactly.
Like, you're the ones who probably run around ED and
Mm-hmm.
just, yeah, help someone
Yeah.
out.
Like, an example.
That's why I don't want to work with you.
Why? Because I
Because
care
if you
too
see me
much.
just no, because if you see me sitting around doing nothing, I don't want you bothering me and start nagging me to do something. It's like, leave me alone.
No, you gotta work, bitch. Like an example today. So this is patient that the doctor ordered heaps of everything. So she wanted bloods, she wanted ECG done, she wanted what else? It
A
was,
full workup.
yeah. It was kind of challenging because the patient had a fall, and he's put into this like immobility sling.
Mm.
And then, like, he was on a sling, but he's not properly on a sling. Does that make sense?
Mm.
He's like, he kept moving it.
Mm,
So
okay.
anyway, so it makes it hard to do an ECG, right? But then I did it. So after I've done it, like, the ECG machine kept telling me that there's something wrong with this patient. And I said, I did it twice
Mm.
for my peace of mind, because I'm not that kind of person who would stop like in the first go, like, okay, I'm so perfect. My all my leads are really perfectly put in. Like, I've checked them though, but like, I did it twice just to make sure that I have to compare both. And then I asked one of the consultants to have a look. and like, give him full details. This guy is coming in because of fall, da 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 da,
Mm.
and um, this patient doesn't have any chest pain or anything, but we discovered that he's on a first degree heart block, and that would
Mm.
probably cause probably the dizziness or the syncope that he had, well, that caused him to fall,
Mm.
isn't it? So I'm like, okay, should we get him into cardiac monitoring? So, like, knowing me, I would do that to anyone. And so I spoke to my CM, and thankfully she had a bed that's available. So I moved that patient. That time we were about to go for a break, and I delayed my
Mm.
break because of that. I'm not
Oh,
saying
good on you.
I'm a martyr, but I just want to do the right thing by my patient, because my patients comes first, not my hungriness, because I'm already like starving, like my tummy is crumbling. But then yeah, that happened.
Okay.
So anyway, enough of me.
Mar, what's
Clap
your
clap.
next pet peeve? I can't think
Um
of anything else now.
okay. I guess it's like, I think this is like a domino effect of everything. I just want to add um people pretending to be busy when
Oh,
they're
that's me.
not.
That's me. That's
That's
me.
Daddy. Hi guys, the boys joined us. Come on, Hero, sit down. Sit down, baby. Come on, come
I'm definitely guilty of that one.
on. Okay. So, did you notice that in your workplace? Like, there's heaps of people who's pretending to be busy,
Oh,
but then
like
they're not.
even worse. Like they're not even pretending to be busy. They're literally hide somewhere, so they don't get to be saying that they're not doing anything.
That's
Like
so true.
I'm actually open to my workplace. If I don't feel like doing anything, I'll sit in front of you and actually show you that I'm not doing anything. If you want to call me out, please do so.
Yeah, but he's been a good worker. I've heard a lot of good things about Roel, so he's a good one.
Lies.
Yeah, but it's not every time that you
But
don't do it work,
the
right?
funny thing though, like I have this trait where I get really agitated if I can't find anything else to
Mm-hmm.
do
Yep.
and I'm on shift. I get really jittery.
Yeah, same. Like, I want to get. Sometimes I'd rather be busy, but sometimes I'd rather be like chill.
Mm.
Like you some days you win, like you just work, and then it's smooth, and it's just you go home and then it's chill. But sometimes it's like busy, like
Mm.
every day is just constantly busy.
Oh,
Oh,
are we still?
I think we're still on frame. But yeah, it's just, sorry guys.
The boys, well, it wasn't accidental because they do it all the time now.
Yeah, exactly. So anyway, that's what happened, and I have that um other staff as well in my workplace. So she
In
does all the talking and everything,
yeah,
and then
every
doesn't
in
doesn't
every
do
workplace there would
anything.
always be that
Something
particular.
person,
Yeah.
yeah. Which is sad though. I guess like maybe sometimes it's good to actually have a reflection of um just reflect on your actions, because I guess it would affect the whole workflow of your shift.
Yeah.
Like you wouldn't you wouldn't understand because it's you. You thought that you're not doing anything wrong, but definitely that burden would be felt by your partner who is actually doing everything, and you're
Mm.
just somewhere getting paid and not actually doing anything. Like
Ouch.
seriously.
Ouch.
No, we have to be mindful of our actions though, because it's kind of reflecting us as a nurse, and also like, would you rather be an experienced nurse who knows skills, like you know the skills that's there in the book, you know how to do things,
Mm.
rather than like, hey, I act like I know everything, but then I don't know anything.
Like in my defense though, because we're usually like me and my other workmate are usually in charge. Like
Yep.
we're more comfortable. Well, not we're not that we're more comfortable.
Mm-hmm.
We'd rather be like doing nothing at the moment, knowing that something will happen later on, and then we'll be ready when
Mm-hmm.
it's required.
Yep.
Because sometimes when we latch into something, and then an emergency happen, and then you're expected there, it's like who's gonna take over whatever you're doing at the moment,
Mm-hmm.
and who obviously you're required to attend the emergency.
Exactly.
So
Well,
sometimes that's well, I don't know. It goes with the role maybe.
I think so. And sometimes like you have to really think of what is good for you, because for me it's just that like stop hiding in the shadows and not doing anything.
Mm.
Might as well try to explore new avenues to learn. And of course there's a lot of procedure that would happen like somewhere out there. I'd rather have you helping the other side of the department or be busy somewhere rather than you not doing anything and not
Yeah.
learning anything. That would, yeah, this is a shame.
I'm probably just over it.
I guess you
I love
are.
my workplace. Love you guys.
Oh my goodness. All right. And I think last one.
Last
Last
one? Okay. Go
yeah,
for it.
last pet peeve that I can remember that I actually wrote down is that people, I think it's just like a domino effect as I
Yeah, yeah,
mentioned.
yeah.
Like people who does more talk, no work.
You just mentioned it earlier.
I know. So it's like again, as I said, it's like
Mm.
a domino effect. But let's wrap this up.
Mm.
What
What's your
can you?
takeaways?
Firstly, um, from your the thing that you mentioned that annoys you. For me, ask
Mm.
because you won't get sued or you won't get
Yeah,
killed
exactly.
if you don't ask. Just ask away, and I think what I've learned when I started, I just kept asking
Mm.
regardless if you find me annoying, I kept asking. And I'm so lucky and quite fortunate that my senior staff that actually trained me, they had the patience to actually train me to do things properly rather
Good
than
on you.
just letting me be
Mm.
and then teaching me like a shortcut like hey you can do this and that. No, they usually tell me that you can do things properly. Yeah,
Mm.
so I'm like I'm grateful for that. It's so nice. What the what else? What's your takeaway as well?
Um, just don't be annoying. It's like
I think it's in
if
every workplace,
no, no,
babe,
no,
not
no, no.
only in nursing.
Like my thing is, if you're at work, make sure your head is in the right. Well, although it's not possible all the time, but if you're going to work, make sure you're there to actually work. Your
Mm.
brain is there, receptive to learn new things. R-
Mindset ba mindset?
Mindset, rather than going there thinking about stuffs that are not work related,
Yes.
and then yeah,
Yeah. Um and also
like
uh,
I'm not saying you don't have the right to think about other stuff outside of work, but yeah, when you're at work, you're expected to work. You're expected to fulfill your role. You're expected to learn.
mhm.
Oh, you okay?
And yeah,
Yeah. So
that's okay. Um I guess like for me, I would also suggest that reflect on where do you want to go in the next couple of years?
yeah, that's a big thing.
Do you want to be a great nurse who's actually know what they're doing, like your patients, your doctors have this confidence in you that they are well taken care of if
Yeah.
they are under your care.
I'm actually gonna second that. Like, do
Yeah.
it every day. Like
Yep,
at the
yep.
end, especially if you're new, at the end of your shift, reflect on the things that you've learned.
Mhm.
Reflect on the things that you've experienced.
Yep.
Um, and then look forward for the next shift. See if there's opportunities for you
Grow?
to grow and actually take initiative of what you've learned from the previous day.
Yeah, I would suggest that some people still do journaling, you know that guys. Like they
No.
still write like diaries of what
Mm.
happened to them. Good on them. I don't do that, but sometimes I will reflect in my own way,
Mm.
and sometimes like I would want to improve. Like every time I get to experience like new equipments
Yeah.
and like have the opportunity to actually talk about experience equipments, then I would ask someone to teach me properly. And then like one time someone actually showed me someone actually showed me how to use this equipment, and I'm like I'm not confident yet, and then she wanted me to be signed off in my competency, but I said no, can I get more experience first before I do that? So that acknowledging, firstly, reflect. acknowledge, and then know your limits.
Mm.
That's it, guys.
And again, at the end of the day, make sure always choose kindness, regardless
Mhm.
of how tough the situation is.
Yep.
Be kind to each other, guys.
Exactly.
Yeah.
And
And
yeah.
before we wrap up the episode, I would like to shout out my wife again for sponsoring my scrubs. It's a
And-
bit too tight, but we can make it work.
Oh, you know what, guys? He really looks good on it. I was about to say that at the start of the podcast. But since you said it, so he really looks good, guys.
Thank
We're
you.
going to take a photo of this. Thanks, guys.
Thank
It's
you.
Sheila.
And Ruel. And
And
again, this is the
CommoNurse podcast. Bye.